Hi, my name is Larry Petrie. I'm here with my wife, Jackie. I'm 64 years old. I am 6 weeks out from robotic prostatectomy with Dr. David Samadi. And I wanted to spend a little time to tell you about what my journey has been like, and it has in fact been a journey. First of all, again, I'm 6 weeks out. These are golf clothes. I am headed to the golf course after this, so that's a happy part of the journey.
Cancer.
I get emotional. I guess it was about 3 months ago that my PSA became elevated, and my internist sent me to a urologist who determined that I needed an MRI. I actually had been aware of Dr. Samadi's work, having watched him on Fox News for a couple of years, and was very impressed with him and his knowledge and his record with this type of surgery. So I actually went to his website and I emailed the office and asked a question about MRIs. I went to see Dr. Samadi. He wanted to do a biopsy. That was worrisome. I can only tell you that relative to friends of mine who have had biopsies elsewhere, Dr. Samadi does it himself. He doesn't trust anyone else to touch his patients. He does it in his office. He does not use anesthesia, but do not worry about that. It was not a big deal. I would rather have a biopsy than get a tooth capped in my mouth. That's how I would compare it. That wasn't enough for me. I went to Sloan Kettering. It's a cancer center. Very, very different experience relative to what I've had with Dr. Samadi. It's a cancer center. You're in the waiting room. I was in a waiting room with 50 to 75 people. It was like a cattle car. You go in, narrow hallways, offices aren't very nice. I met with a very competent surgeon. That surgeon had done 200 of these radical prostatectomies, also robotic. Dr. Samadi has now done over 7,000. Big difference. You want somebody with a ton of experience, and you want somebody with a great track record, which Dr. Samadi has. So I also went to Columbia. You have no idea what I did, but I did a lot of due diligence. I spent a month doing due diligence. So I came back to Dr. Samadi.
We also investigated radiation.
Oh, right. My wife chimes in that I also had investigated radiation. It's not something anybody wants to have to go through, but you can do it, and a lot of good support. So you show up at the hospital and you go to Lenox Hill, and there's a private floor that Dr. Samadi has set up that is like no other hospital I've ever seen. It's very clean, very high-end. Everybody gets a suite. The nursing staff is all hand-picked. They're all very helpful. Most people are in for one night. I really wanted to stay. I was enjoying myself. I stayed 3 nights, but that was me. So you go into surgery. The team in the surgical room are all handpicked by Dr. Samadi. They've been with him for many, many years. This Da Vinci robot is there. It's 6 incisions. Obviously, they knock you out. It's about an 1.5 to 2 hour surgery. Dr. Samadi does the surgery 100%. He is the guy at the controls. That's what you want. You don't want to go to a teaching hospital where you have fellows that want to learn how to use this robot. You don't want them learning on you. So Dr. Samadi does the entire surgery. I have a great prognosis, and a large part of that is, if you read online, you'll see a large part of it is how good is the surgeon. It's all about the surgeon. And I've told Dr. Samadi this to his face. I would not have been able to lay down on that table for anyone but Dr. Samadi. I trusted him. I knew he was the guy. Yes, I did a lot of due diligence, kind of second guessing him, but it's your life. I recommend that you do it also. And the day you come in for surgery, you have to have the confidence that Dr. Samadi is the guy. He has a great setup. You come to his office, all the staff is nice. It's not like going to a cancer center. It's just a very, very different atmosphere. And I would be happy to talk to anybody one-on-one or on the phone if you have any doubts. Do you have anything to add?
My husband's PSA was only slightly elevated. It was just a little bit over 4. And I urge all men out there to follow their doctor's advice, to get their PSAs checked, and to not ignore any slight elevations, because it was cancer and his prostate was full of it. There was a lot of volume, and surgery was absolutely the right decision.
Right, the post-surgical prognosis, I don't think I said it. I was Gleason 7, which is the beginning of serious cancer, and that's what Dr. Samadi had predicted. And I had cancer on 50% of my prostate, so I needed to have it out. I did the right thing and would...
Surgery was life-saving?
Yes, and far, far better for somebody like me than radiation.
And I've got my husband back. He can urinate and more.
Right, it's all good.